Hello dear doctors, I Dr. Sayyida Sara welcome you in Anatomy Student Zone with the topic of myotome. I again starting from this topic with the spinal nerve because as I told you, spinal nerve is very important to understand the dermatome and myotome. When the spinal nerve passes through intervertebral foramina, it divides into a dorsal and the ventral root. So ventral root of the spinal nerve is motor, hence it is related with that of myotome because myotomes are the group of muscle which are innervated by the ventral root of single spinal nerve. So we define the myotome in this way. I am repeating this again. So these are group of muscle innervated by a ventral root of single spinal nerve. As we can see in this image, one spinal nerve that is innervating a group of muscle, and this is also via ventral root, as I told you, that is motor root. But besides the group of muscle, this can also be a case that individual muscle can be innervated by more than one nerve. So these nerves are originating from different spinal cord level. So I told you two scenarios. One includes a group of muscle and the other include individual muscle. Now I will explain you both these lines with example. First, we will discuss one spinal nerve contributing motor fiber to many different peripheral nerves, or a spinal nerve that is innervating group of muscle. Now I will explain you in this image. Like you can see, the spinal nerve C5 is shown over here. This C5 is contributing fibers to many nerves like subscapular nerve, long thoracic nerve, suprascapular nerve, lateral pectoral nerve, axillary, musculocutaneous, and radial nerve. And we know all these supply to different muscles, or I can also say group of muscles are being innervated by one nerve, and that muscle are supraspinatus, infraspinatus, pectoralis, deltoid, bicep brachii, and supinator. This can also be well explained with the example of quadriceps femoris muscle that includes the four muscle as we can see over here. These are rectus femoris, vastus lateralis, vastus medialis, and the vastus intermedius. Besides the quadriceps, to focus on other muscle which are iliacus, pectineus, and the sartorius. These are muscle of the thigh, and these are muscle of anterior compartment of a thigh. You can also see, and these are innervated by the motor fiber of a single spinal nerve, and that spinal nerve is a femoral nerve. So this nerve is having root values that are coming from lumbar plexus, which are L2, L3, and the L4. So femoral nerve arises from L2, L3 and the L4 segment of the spinal cord, or I can say L2, L3 and the L4 myotomes. Similarly, it can also be a case that I already told you that the individual muscle can be innervated by the more than one nerve. So as we can see over here, the radial nerve is a peripheral nerve of upper limb, and this nerve is receiving sensory fibers from C5, C6, C7, C8 and T1, which are coming from brachial plexus. So more than one root values this nerve is having. So when the individual muscle is innervated by more than one nerve, it means a muscle can be made up of more than one myotome as well. Therefore, myotome testing is difficult because the individual muscle can be innervated by more than one nerve, or there can be a case that the single nerve which is originating from multiple spinal nerve as we have seen. Now question is how we test these myotomes. So they are generally tested by checking the patient ability to perform the specific action or a movement which are associated with different spinal nerve, because the individual muscle can be a part of multiple myotome. So in this regard, the function of the muscle is very important. Hence, don't take the muscle function easy, and this is having great clinical significance. So if we take the example of quadriceps femoris muscle that I told you, this consists of four muscle which are rectus femoris, vastus lateralis, vastus medialis and the intermedius. And this is a muscle of anterior compartment of thigh. It is innervated by the femoral nerve. So quadriceps femoris is an extensor of the leg and the knee joint. It means we can use these movements to test the L2, L3 and the L4 myotome level which are supplying the femoral nerve, because the quadriceps femoris is innervated by the femoral nerve, and which this arises from L2, L3 and the L4 segments of a spinal cord. Hence, we can test these movements which are extension of the leg at knee joint by testing these myotomes. Now, how I will test these movements? For this purpose, we do different reflex. For example, knee reflex or a knee jerk. This is also known as the patellar reflex. This is a reflex which tests the L2, L3 and the L4 segments of the spinal cord, or I can also say it tests the L2, L3 and L4 myotomes. So this is a stretch reflex, mean in response to stretch, muscle contraction occurs. So when we strike the patellar tendon with the reflex hammer just below the patella, it stretches the muscle spindle in the quadriceps femoris muscle, and this stretching of a muscle spindle produces signals. These signals travel to a spinal cord at the level of L2, L3 and the L4. From here, the efferent impulses travel back to a quadriceps femoris muscle, and the response that we are going to observe is contraction of this muscle. So how we can observe this response? This is by means of a kicking motion of a leg that can be observed. So the absence or the decreased reflex indicates a problem. Normally this reflex is absent in a sleep. It is also absent in the lower motor neuron lesions. So summary is that this test assesses the L2, L3 and the L4 segment, or the L2, L3 and the L4 myotomes. Like dermatomes, myotomes can overlap. So even though the myotomes have been mapped to a certain area of a body, the mapping is not precise like we have seen in the dermatomes. So that was all about this topic. Thanks for watching. Keep subscribing and like this channel. And don't forget to hit on a bell icon for the upcoming videos. Thank you.